So essentially, it's a very simple study. So essentially, we're looking at this unfit non-small cell lung cancer patient, stage 3B and 4, who were unfit for standard doublet chemotherapy. As you know, cancer immunotherapy treatment has transformed the treatment landscape for metastatic NSCLC patients. But there are many recommended for the fit patient. It's important to remember all the first-line pivotal trials with immunotherapy, with or without chemotherapy, comparing against standard platinum-based chemotherapy, were restricted to fit patient, PS0 and 1, because of concerns about toxicity and concerns about treatment tolerance. So in reality, we got this big population of unfit NSCLC population, 40%, and many of which just simply cannot be treated with standard doublet chemotherapy. They are predominantly elderly with multiple comorbid problems, with multiple medications, diabetes, heart disease, lung disease, peripheral vascular disease, cataract, and you will not treat with doublet because they just cannot tolerate them. So currently they are treated with single agent chemotherapy which are better tolerated, or they are offered best supportive care. So it's a simple study, just focusing on this population who oncologists will just not give any standard platinum-based chemotherapy. So it is an immunotherapy trial with first-line atezolizumab comparing against single-agent third-generation chemotherapy, gemcitabine or vinorelbine, as recommended by several treatment guidelines. So you saw the results, impressive results. Ipsos met its primary endpoint, hazard ratio 0.78, 22% reduction in death. But more importantly, when they look at the one-year survivor, 44%, and two-year survivor, 24%. So at two-year survivor, we are talking about 1 in 4 patients still alive at 2 years. So just imagine, these are unfit elderly population, which historical data show they have a median survival of less than 6 months. And we also look at other parameters. Obviously, quality of life is very important for these symptomatic patients. And we saw there was stabilization in many of the function domains. And also we saw improvement in symptoms, cough, appetite loss, chest pain, which is significant because these are symptomatic patients living with a cancer and living with their comorbid symptoms. We look at the toxicity, and we saw they are not bad comparable to historical data. And compared to chemotherapy, even though we get nearly double the duration of immunotherapy treatment, we saw the toxicity, grade 3, 4 AE were less. When you saw early on, it was, I remember correct, was 33% versus 13%. So in terms of overall survival, in terms of quality of life, in terms of toxicity, and after 20 years of clinical trials, which has not brought much significant new development for this unfit population, this trial shows that immunotherapy can benefit them. I think the take-home message is we show immunotherapy treatment works for unfit patients who are not suitable to be treated with standard platinum-based chemotherapy. And the result is impressive when you look not only the hazard ratio, but you have to look at the one-year survival data and also the two-year survival data. 1 in 4 patients still alive. And you also have to remember the quality of life outcome for these very symptomatic patients, where we saw stabilization over a long period of time, as you can see on my lecture presentation. So in summary, Ipsos trial is the first immunotherapy trial with atezolizumab that shows it improved overall survival regardless of histology, PD-L1 expression, and performance status in patients considered unfit for doublet platinum-based chemotherapy. Thank you.